I'll call the meeting to order. Can we have a roll call?
Director Leach.
Here.
Director Jeffrey. Here. Director Stanicek.
Here.
Director Mraz. Present. Director Brown.
Here.
Thank you. We have quorum.
We'll say the pledge. You begin.
I pledge allegiance to the flag of the United States of America and to the republic and one nation under God, indivisible, with liberty and justice. Sorry.
Can I have a motion to approve the agenda?
So moved.
I'll second that. Any discussion?
Director Brown.
Aye.
Director Mraz. Aye. Director Stanicek.
Aye.
Director Jeffrey.
Aye.
Director Leach.
Aye.
Thank you.
Do we have any public comments?
None.
Okay. Anything online?
No.
Thank you. Can I have a motion to approve the consent items? So moved.
I'll second.
Does anybody, would anybody like to pull one of those items or discuss anything? Okay.
Director Leach.
Aye.
Director Jeffrey.
Aye.
Director Stanicek.
Aye.
Director Mraz.
Aye.
Director Brown.
Aye.
Thank you.
We have a presentation. Shay's out to present for us for Fallbrook Food Pantry.
Hello,
Get in here.
how's everybody?
Good.
Good. I'm Shay Golick. I was the executive director. I am now the CEO of the Fallbrook Food Pantry. And thank you so much for allowing us to come in this afternoon or this evening and give you a little brief description of what's going on across the street. And so we'll just kind of dive right in. As some of you may know that have been on the board, the Fallbrook Regional Health District and the Fallbrook Food Pantry have been working cohesively for the last 20+ years. We've been very blessed to have received over $1 million worth of grant funding since we partnered up with you guys in early 2000. So we are incredibly grateful for that. And without your guys' support, we certainly would not have been able to serve as many people as we have. And not only just from myself as the CEO, but our board also feels very grateful and dedicated to the relationship. And so this is something that, you know, we really cherish, and I just wanted to make sure that you guys are all aware of that. So let's see, let's go to slide 1. Since the inception of Fallbrook Food Pantry, which happened in 1991, it started out in a small church and moved around for a few years, 3 or 4 years, and then multiple churches came together to develop what then became an actual food pantry. It was still considered a Fallbrook community project. And in 1995 or 96, I believe, the Fallbrook Food Pantry actually moved over to, actually, no, that was incorrect, 1999. The Fallbrook Food Pantry moved over to aviation, a small little dungeon of a place, but it served its purpose for the time that we were there at 24 years. And in 2019, I joined the organization in 2018. In 2019, we were very blessed to have been able to purchase our own building, which is right across the street. So for those of you who have not come in for a tour, we would love for you to come in for a tour.
Don't worry, you'll be getting your site visit invitation soon.
Oh, good, good. And you know, when I came on board, I really was dedicated and focused on kind of reinventing the pantry and tapping into this amazing agricultural community and the people and community members that support it. And so for the last 5 years, I've worked very diligently in trying to add education to the client base, not just giving food, but really trying to help break the cycle of being so dependent upon the system. So our mission has changed a little bit. And what used to, you know, focus on, you know, just making sure that the needy receive food, we are now expanded into the Fallbrook Food Pantry provides access to healthy and nutritious food for all Through food distribution, education, and health monitoring, we work to address food insecurity and the social determinants of health by reducing inequities. Our programs empower our clients to become self-sufficient, independent, and productive community members by offering a well-balanced selection of food, nutrition, wellness, and vocational education. So if you don't know already, the Fallbrook Food Pantry in 2021, we built out a learning center. And the goal has always been that we serve our clients first and then make accessible to the community any education that we have, that we generate out of there. But really our main focus is making sure that our underserved families truly get what they need. And so when we talk about nutrition, wellness, and vocational education, that really is where we've put a lot of focus into what we're doing. So the food is because we live in this amazing community and we have local farmers and growers and stores. Since we're the only pantry, we have 16 partners that stretch from Fallbrook, actually Murrieta, Temecula, Fallbrook, Vista, San Marcos, and Carlsbad for food that we pick up every single week. We now have over 16 or 17 partners, and because the Fallbrook Health District has really helped us be able to fine tune our logistics and our operations within our pantry, we really have become a very well-oiled machine. So when things come in that aren't good, we have just created in the last year and a half, a animal food rescue program. So we now, at one point before COVID, really, COVID kind of changed things for everybody, but up until COVID, we had about 600 pounds of waste a week. We now have 0. So, we're very proud of the different types of programs that we have, and you guys help support all of that. It's not just the food, it's all the programs that help facilitate the food and what goes, what encompasses all of that. We could move to the next slide. Through our nutrition and education programs, we strive to promote wellness and provide a healthy, well-balanced selection of food for every individual in our community. As the only full-service food source for people in need in Greater Fallbrook, we provide support for an average of 50,000 household visits annually and over 6,500 hours of nutrition, wellness, and occupational education every year. We really have a holistic approach, and that being that our services promote food system equity by helping food insecure families break the cycle of poverty and improve their health outcomes. So with that, we have the nurses that come in, they do just a standardized, which I'm sure they're probably doing over at the Wellness Center for you guys, blood pressure. They work, so we're really focusing on the diabetes and diabetic patients and obesity and trying to prevent that, combating that, preventing it, managing it. So with the partners that we have that we all seem to share in this beautiful community, the nurses have really been an integral part of what we're trying to do so that we not only are giving our clients healthier food that you guys have helped put in their baskets, but educate them on their current health situation and how food really truly becomes medicine, and along with movement and all the beautiful things that we try to instill in our own lives. We're now trying to do that with a community that typically is very uneducated and really has no even bearing or self-awareness of truly what health and wellness means to them culturally. So it's always a sensitive conversation to have with people, especially when you can't speak their language directly, but luckily with translators and Spanish speaking staff that we have and nurses that can speak, I feel like we've really kind of bridged that gap over the last few years and been able to talk to them in their native language and really develop that trust and connectedness with them. And so now they're starting to trust a little more what we're saying, and so that's always a good thing. Fallbrook Food Pantry believes that everyone deserves access to healthy, nutritious food, and we are committed to serving our community with compassion and care. That's one thing. We do go through a very extensive interviewing process, But every person that comes to the pantry, regardless of what their circumstances, they get 3 free, what we consider emergency food distributions. And that just means that, you know, we're not gonna require all the regular documentation, because if they've never been here before, it's probably an uncomfortable situation as it is. So we just wanna make this an easy, non-traumatic, dramatic situation for a lot of people, because we get everything from women fleeing abusive situations to people losing their jobs to just circumstances of socioeconomics, whatever. And so we really just want to make sure that everyone has food. If we can go to the next slide. So our food insecurity in Fallbrook and San Diego County is a complex issue resulting in poverty, inflation, lack of affordable housing, low wages, racial inequities, lack of access to affordable nutritious food, health problems, and high medical costs. Everything I'm sure you guys are all very much aware of, being who you guys are and having your wellness center. But this is something too, as a food pantry, we are equally as invested in the overall health and well-being of every member of our community as you guys are. So I do believe that we run a very parallel vision and strategic plan as far as who we're helping, why we're helping, and the importance and impact of that. So we're not just your regular run-of-the-mill pantry where you show up for food and you leave. We really care about our people, and we try to learn about them and take time to understand their circumstances and situations, so they have more of a wraparound community that, you know, it's safe for them to come to. Get the next slide. So this is a very generic and kind of basic description of kind of how we base the families and what they qualify for. So if a single person comes to us and they're earning less than $2,855,000, and this is based off of the federal guidelines of poverty, so we follow them very strictly, then that individual qualifies for food as long as they have all the other documentation. And then you can see, up to 6 people, it's $7,888. It's not chump change anymore. And that's the thing that's really unfortunate, is that when you look at the dollar figure of income and you relate it to the cost of living, especially in California, $7,800 for 6 people is really not a lot. So, that's just barely $1,000 per person, and, that money goes quick. So one of the things that we're really proud of is, aside from the fact that we have now qualified, registered active households, 5,575, that is a huge increase since COVID. We were hovering around 3,000 in 2019, 2020. And because of the spike of COVID and all the families needing extra help, within a matter of 2-3 months, the numbers just soared. And they calmed down a little bit, in 2020, late 2021 into 2022. But now that things have changed with SNAP dollars and EBT and, and on all those programs, we saw another spike. So we really have been maintaining an average of 650 families per week, which translates to over 3,000 individuals every single week that are receiving food from us. One of the things that we are very proud of is that per person, each person in a household receives 12 to 15 pounds of food, and the majority of that is fresh produce. So they are receiving a very healthy, very nutrient dense grocery list, if you will, of being able to make, very healthy meals. And through the Learning Center, we're teaching them how to do that. So that's something that, we do feel good about, knowing that we are sending them out the door with good quality food, and very little is processed. We can't eliminate that altogether, but it's certainly less now than it was 2, 3, 4 years ago. Okay, next slide. So you saw this probably if you browsed through the report that I also provided for you guys. This is something that we too are very proud of, and our successes are because of your generosity and our community. So in 2022, we served 5,200 individuals. Our monetary donations were $253,509. We registered 437 new households, and I can tell you, and that was 2022. I can tell you that as of where we stand, end of July, we had already exceeded 430 new families in the first quarter of, or first part of 2023. So things are getting really gnarly again, unfortunately. Our special events last year, we raised 144,267. Our learning center, as I mentioned earlier, we had a total of 6,579 student hours, and that ranged from ESL, cooking, nutrition, our awesome Nutrition to Grow On program that we have over at the Wellness Center. If you guys haven't popped over there, you should. The garden beds are beautiful. And then our grant awards, which includes, of course, a large portion last year. You guys, I think we received about 120,000 from you guys last year, and our total was 211. So you guys really have been a huge supporter of ours, and we greatly appreciate everything you guys have done. And you know, we can't imagine us not being able to continue this relationship, because it's a huge impact, and we really do appreciate everything. And then our last slide. So this is just a recognition of more than 20 years of working with the Fallbrook Regional Health District. And I can tell you that with all the new and exciting things that have been going on in the last few months, our future really does look bright, in the sense of, you know, it's unfortunate that we're serving all these people, but we're very mindful and aware of certain situations. And when I say that our future looks bright, we're really kind of shining that onto our clients, knowing that we really are helping them and going above and beyond besides the food. One of the things that's going to be happening here in the very near future is the pantry will actually start growing our own food. So we've been donated some land. I'm sure you all are very familiar with Kendall Farms, and they are donating 1.5 acres of land to us, and we will start growing either later fall or early next year. So then the pantry also, not only are we allowing and showing and teaching our clients how to be self-sufficient, but then it also allows the pantry to become self-sufficient as well. So, and this is something, you know, we want to keep you guys in the mix of all of it, and we're just really excited and grateful for you guys. So thank you for your time. Are there any questions? Yes.
So as I was hearing this, and I'm relatively new to this side of the house, so I'm trying to understand, but there seem to be a lot of parallel activities between what you guys are doing and the wellness center. Are we at a point, or has there been a transition or trend occurring where there's some overlap and economies of scale that can start developing between the two organizations?
Yes.
To enhance and grow the depth for which we're impacting?
So, the answer is yes, we've been growing in parallel, and so we've been having conversations to make sure that we're not overlapping.
Okay.
One of the original concepts behind the Community Health and Wellness Center was a no duplication of services.
Right.
So what's nice is that their diabetes program is more self-management and really working with folks who may already be going down that path, where our DPP program is a deeper dive with folks who are already in that path. So they're complementary.
Okay.
The Nutrition to Grow On program and some of the growth are happening at the Wellness Center, and they're helping to educate folks at our site, and that can help expand that. The reason we both have this Cheshire grin.
I know, I'm like,
going
okay,
on.
I'm gonna let you say it. Since you told me not to.
We identified space at the Wellness Center that is really unusable for anything else. So they're gonna be putting in some garden beds to specifically do some gardening education about how to grow your own food. And then being able to use the building C, the house kitchen, to really demonstrate how to cook with it, how to use with it. And that, again, isn't something that we need to do, but it was definitely part of the needs assessment that came out of our Catalyst report. So since they're already a grantee partner and a community partner, it's a perfect use of joint resources for that space.
And what's really great, so when I called Rachel a month or 6 weeks ago and said, hey, I've got this idea, what do you think about it? And she's like, oh my gosh, yes. And this is something that, I mean, we've been very conscientious of listening to our clients and the community even if they aren't an active client now, but they are in need, we've gone over to the Fallbrook Community Health Gardens, community gardens. We've spent time with the people there. We really understand what they want. And they really do want to grow their own food. They want nutrient dense. They want good, healthy food. And so many of them don't know how to grow to get the best nutrient dense food that you can. So much of it is the soil, and the soil over there is in bad shape. It's not all that great, but you know, they're doing their best. So what we want to do, because we don't want to step on the toes of, you know, the mission, resource conservation district, as a mouthful, and Vosa's Day Fallbrook that kind of oversee that whole space. We didn't want to step on their toes, but we at least wanted to learn from them and find out what they're doing and where their deficiencies are, so that maybe we could fill those gaps. So what we're trying to do with the garden over at the wellness center is that it will be filtered directly through the pantry, and they actually have to be a client as well as seeking education. So they can't come and learn these things without really needing the resources that we provide. So there's kind of that caveat that separates it from being a community garden, because it's not going to be a community garden. It's going to be very inclusive, but specific to our clients that are asking for, we want more nutrition, we want more produce, you know, and that's the one thing that, you know, that we've really suffered from. And it started even earlier this year. We started to see the decline in probably March or April, but I would say even in January or February, and you might have seen it yourselves when you go to the grocery store, shelves are bare, there's just not as much. And we were a little freaked out. We start a little bit, but our partners with San Diego Food Bank and Feeding America in early May, or June, I think, they sent us an email informing us that because of the food shortage that is nationwide, that food banks are having to spread the food that they are getting, which is significantly less, to everybody. So when we were receiving 6 or 8 pallets a week of food, we're now getting 2. When we were getting, and that's from San Diego Food Bank, when we were getting 4 or 5 from Feeding America, we're now getting 2. So we're only getting 4 now a week, and we blow through that before the week is over. So the partners that, you know, we've partnered up with the grocery stores and other farmers and stuff, that's really made a huge difference. But this is the first time since I've been with the pantry that we've had to spend thousands and thousands and thousands of dollars of buying food. And we've never had to spend that kind of money. And thank goodness you guys supported that, because it really did come out of those coffers to allow us to, you know, keep up with the masses. And yeah, so, you know, we're trying to be creative, but also allow the relationship that we've always had blossom even more to really make a bigger impact. And I feel like as a, you know, it's mutually beneficial that the programs will just continue to grow and become bigger and stronger, and I'm excited about that.
So question,
Yes.
so when you have to go out to the open market to purchase food to stock in your shelves, where would you go for that?
So luckily, Grocery Outlet, the owner in Fallbrook, Jeff Brantley and his wife, they are on our board. Jeff's on our board. So thank goodness he actually buys food for us. We place an order, he buys it for us, and he doesn't mark it up. So we're getting wholesale, which is life-changing. And we're ordering pallets of food from him every week. So you know, we just started a new breakfast program over the summer because the kids, you know, even the schools, because of the food shortage, the schools weren't even able to offer the breakfast program that they did, that they have been for years. And this year was the first summer that they didn't offer it. So we said, okay, well, we're going to do that. We're going to take some of the money that we've received from you guys and a few other partners, and let's make sure that these kids have breakfast. I mean, it's the most important meal of the day. So we spent a lot of money this summer, probably $25,000 just in breakfast food for kids. So it's, you know, it's important, but it's got to be done.
Okay.
2 things.
Yeah.
When we think of service area,
Mhm.
we've got Rainbow, Duluth, Fallbrook, Bonsall. So can you give us a sense of, sorry, I have a retainer in my mouth.
Oh.
I knew I had surgery this morning. Yeah. Can you give us a sense of coverage? What is your experience with those sub-communities that we have?
That's a really great question. So, within our 5,500 people, that is ultimately 10% of the overall population of Greater Fallbrook. I think it's grown quite a bit in the last maybe, 2 or 3, 4 years, but we're right around 10%. Of that 10%, there's still an additional 20% of low-income families that just haven't come seeking the services that they really do need. So there's still an additional 20% that aren't being served for whatever reason, whether they can't get to us or they haven't heard about us, which I've been on a mission for 5 years to change that. So whatever their circumstances are, there's more people still in need than we have that we're actually serving. So, and that's really sad, but I would say that as far as like demographic goes, we are at about, so it's 80% are women, 20% are men. The Hispanic community is about 60%. Then it's the Caucasian community, and that's like right below that. And I want to say we're like 40%, 30, 35, 40%, and then the remaining are kind of the others. And the majority of the Hispanic community, they all have, to come to the pantry and have an active card like they get at Costco. They have to prove that they have jobs, that they are working, that, so the things that we're able to check off for every person through our interview process, we feel good about knowing that we're not just, a free ride or, giving it away, to anyone and everyone. Although, I have a very strong personal connection to all that because I look at it as, everyone's human and everyone deserves the right for food. So, my personal heartstrings, sometimes I get tugged on, but it really is more about the control, the quality control, and making sure that our local people that live here, work here, and have a life here are the ones that are being taken care of first. And that's 5,500 households. So it's a lot. Yes,
So
Terry.
to follow up on Director Jeffrey's question, I appreciate the fact that she was including Duluth and Bonsall in the outlying areas. My question to you is, if I was to look at your mailing list of the 3, 4, 5,000 households, whatever you have, how many of those would I see from the areas of Duluth, Bonsall?
Very few. The majority,
Okay,
that their address is Fallbrook. Their
And-
city is
and
Fallbrook.
here's my point.
Mhm.
The resources that we provide through the health district to the food pantry
Mhm.
come from those particular areas too.
Yes, that's right.
So how can we reach out to those areas to get them to be able to have their share of the benefits that you provide?
Well, that's a really good question. And it's kind of hard to, the thing that I find really interesting about this community, we're kind of this hidden gem, right? No one wants to, once you're in, we don't want anybody else in, which is one of the things I love about this community. But we have found it to be very difficult to try and get to all the people that we know that extra 20% that needs us. We're having a really difficult time getting to them because whether they are just making themselves under the radar, living that way, or whatever their situation is, I don't know. I don't necessarily have a solution to that. The only thing that I do know is that through the programs that we've been recently doing through the Learning Center, the education, we are now in the schools. So that is one way that we feel is probably the closest direct contact that we can get is to plug the kids with the information and all of our services, in the hopes that they will then go home and say, oh, we had class today with Fallbrook Food Pantry, and and then inquire about, oh, well, who's that, or so we're hoping that that is going to, and we've only been working with the district for a few months. We did it the last, 6 or 8 weeks of school year and of this past school year. So we're still new with them. We start back up September 5th and
And that was the Fallbrook School District?
yes, Fallbrook
elementary
Unified
schools.
Elementary School District.
Because Bonsall does have a school district
Yes.
also.
Yeah, we are only working in all 7 elementary schools. We have all 7 elementary schools in Potter. So we are only in the Fallbrook school system.
Okay.
Mhm.
So that's my point.
Yes, yeah. So, and that's, like I said, we're hoping that that relationship with them will start to spur some additional interest or inquiries from families that do need us and didn't know where we were or whatever. So, but we know that there's 20% that still need it and they
What
just
about
haven't.
Bonsall School District?
We haven't done anything with Bonzel, but what's really interesting is that Bonzel, what's interesting is that Bonzel, so Bonzel does a food drive at what's the name of the school?
Sullivan.
Sullivan.
Middle School.
Yes, and one of the teachers there, she's amazing. She's been doing it since I've been here. She has really spearheaded a lot of programs out of the school to support the Fallbrook Food Pantry. So because we just learned of some of the new programs that the school districts have qualified for these after-school extracurricular activities, which is where we're filling in with the school district in Fallbrook. We just found out, actually Catherine and Sousa found out just a few days ago that Bonsall also has a program. It's much smaller, so we just have to develop that relationship and present to them and see, how we can get ourselves, active in their programs as well. So, it's a work in progress, but we definitely are making sure that at the school districts, that's the end, that's the shoe in, and we think that that's really where we'll be more
I'll
successful.
always remember there's Biosito School District
In Rainbow.
with poverty levels
Now, are they their own district?
Yes.
Okay, that's what I thought.
and
Okay,
Bonsall
yep,
with their poverty levels. So broaden,
Yeah.
aperture,
yep,
love it that you embedded in the 7 schools here, which means you've test driven this thing.
yep,
So this is an encouraging note to make.
perfect. This is
Okay,
great. This is
so-
good news. Yeah, because, I didn't want to bite off too much, that we
No,
can
we
chew.
get it on
And
ramp.
now that we're
Okay.
scaling up, that is on our,
That should be on the radar.
it is, absolutely.
And a note that should be brought forward is that with the location that they're in now, there is now finally public transportation to them.
Yes, finally, a bus station.
So the
Or
bus
bus stop.
station, public transportation is not readily available to all parts of our district, we know that. But at least now Bonsall can access to the food pantry,
Yes,
which is good.
Yes.
Rainbow's still another story, but I know that Katya, our community resource navigator, is doing a lot of work with Biocitos, with their superintendent. And food insecurity is definitely one of the pieces that she hears a lot of, so
yeah,
there is a lot of cross communication. They receive their own food support. I think they're Feeding America
It's,
there, or are they San Diego?
it's San Diego Food Bank.
They're San Diego Food Bank there. So there is a strong opportunity to get all parts of the community connected through all of these various partners.
I guess the only thing I would like to leave it with
Mhm.
is that the resources that we provided to your grant request this last time and hope to do again in large amount this next time, those dollars did come from Duluth and Fallbrook, not just, or Duluth and Bonsall, not just Fallbrook.
Oh, okay, that's good to know, because, and it's interesting because, I don't know if
It may be the
everyone on our,
Fallbrook Regional Health District, but it's the Regional Health District, which includes those outlying areas,
okay,
which contribute their
Okay.
tax dollars to us.
okay, that's excellent. Yeah, I mean, I would say that, as far as like population goes, percentages, I would say probably 70% is Fallbrook, and Paula and Rainbow and Bonsall and Duluth make up the remaining percentages. But Bonsall probably Duluth being the next, then Bonsall, because Rainbow, we're far enough away that they're not, I mean, we even tried, we were working, so are you guys, do you know who Barbara McLean is? She was on our board years ago, but she actually started the program for the food distribution at Velocito. And she was trying to get the pantry to take it over. And because of manpower, we didn't have the ability to go and man the programs there. So we were trying to get the families to come, letting them know, okay, you'll still get that food distribution, but you can also come weekly to us. And they just all said that most of them walk, they live where they live because they can walk to the school.
Right.
And they don't have the transportation. So, there's some challenges over there, but it's nothing that's not off our radar. I mean, these are all locations that, we include when we speak of Greater Fallbrook, we think the same. So it's just a matter of getting those programs rolled out into those areas.
Could you let me know if San Diego is still bringing the produce up and having the deliveries once a month, or how often they should?
So we are still doing the neighborhood distribution, but we are no longer doing it at the church's parking lot, which we've been doing there forever. We actually are now doing it out of our parking lot because the food allotment is so small that it's too much of a hassle to go back and forth during that day. So we just do it here now. And we've been doing it that way for, I don't know, maybe 6 or 7
cut it
months.
down significantly.
Oh, it's significant. We were getting 30,000 pounds in one day, giving 30,000 pounds out in that same day.
Yeah.
We're lucky if we get 5 or 6.
Is that shortage due to supply chain, weather, drought, manpower on the farms? What is
All the above.
so this is a confluence of these factors that are choking off the food distribution?
Yep.
Wow,
And it's also being reflected in the grocery stores.
absolutely.
So, yeah, it's a lot of changes. Anything else?
Thank you.
All right,
Okay.
I don't have any questions, but I appreciate you
Great.
coming out.
Thank you so
Very
much
good
for your
stuff.
time.
Thank you.
Thank you. Thank you, Shay. Absolutely.
Okay, well, we have reports coming up next. We'll start with the finance committee.
Yeah.
Director Brown.
You betcha, fair enough. So the finance committee met last Wednesday and so the treasurer's report for the period of June, report number 1. Total liabilities on equity for June were $11,789,929 versus May, which was $12,217,966. For an overall decrease of $428,036. Report number 2, our income statement. Total net income for the month of June was a negative $284,632, due in part to a smaller than expected property tax apportionment and increased costs. Report number 3, profit and loss actual versus budget. Based upon the approved budget, the district is under budget in year-to-date net income by $56,741. Report number 4. The approved annual budget for the 2022-2023 fiscal year has had no changes through any board action. Report number 5. The LAIF account statement. LAIF posted no dollars in quarterly interest earnings for the period. The cost value is $2,653,515 with a fair market value of $2,613,257. The performance rate for the month of June was 3.167%. Report number 6, our CalTrust account statement. The cost basis for this account is $5,848,841. The district earned $15,938 in dividend income this month and an unrealized loss of $34,908, bringing the portfolio's total value to $5,647,767. As of June 2023, the 1-year yield on the medium-term fund where these funds are allocated was 2.56%. Report number 7. Property tax revenue. The district accrued a tax apportionment of $24,874 for the month of June. Report number 8. The check detail report. This details the operating accounts, deposits and disbursements for the district for the month of June. In the finance committee meeting, we reviewed the activity and found nothing extraordinary in the reporting. Report number 9, the Visa statement. This report, which lists all the charges made using the district's credit card for the month of June. And again, at the committee level, we reviewed those charges and found nothing extraordinary. Report number 10, the Community Investment Funds report for June. This report shows utilized funds invested in the district's real estate, primarily for the redevelopment of the community health and wellness center, including maintenance, repairs, permits, and consultants. For the fourth quarter, there was $64,000 spent roughly, and the recommendation is to transfer $64,000 from the LAFE account to operating. And if the CEO needs to add anything verbally to that, she may do so.
No, just if you are following along here, you'll see that we, were able to, from the auditing standpoint, move some of our construction in progress costs out. So if you look at this, you'll see it says 158,894. Of that, 93,772 moved from construction in progress to complete, which is why we're only requesting the 64,000, not the 158, to reimburse the operating account.
Thank you. And finally, under disclosures, the investments of the district are in compliance with the district's 2022-23 investment policy. The balances in the district's investment accounts give the district the ability to meet its expenditure requirements for the next 18 months. And that's it.
Thank you. Any questions? Facilities, Director Jeffries?
Oh, we did not meet this month.
That's an easy report.
If the AC had given up just earlier, we would have. Now.
Don't worry, we're gonna talk
We're gonna
about the AC.
We did have a strategic planning committee meeting. We basically just kind of talked about the ongoing urgent care discussion and some of the need in the community for that, and kind of exploring different options. I'll kind of leave a lot of that for Rachel's report, unless Barbara, do you have anything to add on that?
No, it's a continuing, to be continued.
Yeah.
It's something that has been with us a long time. We're making progress, but it's something we're gonna have to continue to work on. I don't think we're gonna ever resolve it unless we end up with our own entity that we create. Personally, I think we should.
Yeah.
Think about
But
that.
it's definitely something where, there's a need in the community, and
But
there's
we
definitely
did-
a lot of sentiment. so
Right, but
we're
we did
definitely
make
exploring.
recommendations to help people at this point in time with urgent care issues, so that they could sort of triage at home, look at the website, see what we have available for education. So that's the most important thing, to calm down, stay focused, find out what's really going on, take precautions, education, and be aware beforehand and prevent a lot of things. So
Absolutely.
we're gonna work on that till we get it squared away.
Yes, ma'am, you got it. Next up, we have governmental and public engagement, Director Stanisek.
Yeah, we continue talking mission vision. I think we're getting it down to the final version with some input from Rachel and the team as well. So we're getting very close on that. So I think we're gonna actually have that maybe a little bit later discussion. Looking forward to the CSDA meeting coming up to get to connect some people.
This is in the packet. Do you want to pull that up for today?
Sure. That's the old very, yeah.
So this is our update from this last meeting. We took some of the information from the previous, we did some more discussion and wordsmithing. So we put this one forward in the packet for review. And it's of course, obviously up to the board to take some time to look at it, see if there's any additional edits to this.
I think we're very close. Yeah, I don't have any additional input. I think we've captured the elements that we were talking through from the concerns that came up. So I'm pleased with where this is right now and love to get other in.
Should we address this now or just? Okay.
I would say, yeah, this is,
Okay.
it falls better under their report.
Awesome. Yeah, so we'll just go ahead and address this. This is item G1. So this is the some of the revisions that we made. As you kind of go over it, I just wanted to thank staff. Staff gave a lot of really good input on a lot of that stuff there. It was really helpful. I know some of this wordsmithing is incredibly difficult when you get down to the meat of it. One word versus another. Obviously, the mission and the vision of the district is a incredibly important part of what we're doing. I mean, it's we're us trying to capture what we do as an organization, and so I mean, this is what we came up with. I don't know if any of the board has any questions or would like to make a motion, or I'll just open it up.
Well, I'm energized by the use of active verbs. So I'm liking the notion of by directing resources. I think that's a very strong statement about what we do.
Yeah.
We direct the resources. The engaging, highly skilled staff partners and passionate volunteers gives voice to our kind of kinetic sense of things. And the notion on the vision that we deliver and we support. I think those are two very good verbs to describe what we're doing, and I think the values are spot on.
Anyone else? Would anybody like to make a motion to make these modifications?
I would like to just suggest humbly, one word to be, considered to be changed. Third line next to the last word, the word able.
Mission or vision.
So in the mission statement. In my mind, I think we want to be able to endeavor to offer the health and wellness services. Not that we are just able by the actions we've taken. That'd be my only humble suggestion to your hard work, which I do appreciate.
Endeavors too.
I like it.
I like that.
Yeah, I mean, I think that definitely sounds good.
Another
So
verb.
we could have used you in some of those committee meetings.
I know how hard it is to get the groundwork, so I'm just adding on to your very fine work.
Stand by.
Appreciate it.
No worries.
Well, I would entertain a motion if somebody would like.
I'll
to.
second.
So you're making the motion, Barbara, that will accept the
No, you
mission
made
and
the
vision
motion.
as presented
No,
with
I didn't
the
make any
edited
motion,
endeavors.
Oh, absolutely. It's getting better all the time.
Can I have a second?
I'll second.
Any further discussion on any of that?
I'm good.
Okay. All right.
Director Leach,
Aye.
Director Jeff,
Aye.
Director Stanis.
Aye.
Director Morant,
Amen.
Director Brown.
Absolutely, I.
Thank you very much.
Thanks for letting me put that back under this report. I didn't want to lose momentum from the government
This
policy.
is great.
engagement. So,
Absolutely.
No, it's good.
Perfect
That's a good
timing.
place for it. Yeah.
okay,
No worries.
sure, thanks. We'll go back to Teresa's report.
So,
Sorry, I jumped ahead of you, Teresa.
You're good. That totally made sense.
So, Community Health and Wellness Center, Teresa, go ahead.
Okay, thanks. Well, summer has continued to be a busy time. So in July, we had a total of 85 events that happened, 66 public, 19 private. August, we have 94 events scheduled, 73 of them public, 21 private. And so in June, we hit a new high for the amount of visits to the Wellness Center. Probably hit 1,000, but I can confidently say it was 992. But so we're like right there about to break that. We had some new events coming to the Wellness Center. One of them is Fun Fu, which is like a karate-based self-defense class. We brought some Qigong into the evening. We've been doing a healthy aging series with the San Marcos School of Nursing. Foundation for Senior Care has had their computer classes that they do quarterly happening, as well as the food pantry's nutrition to grow on. And Michelle's Place has brought some Tai Chi. So we're trialing out the Tai Chi for the next month. It may become a regular event there. Just in terms of the campus, you got the email that the AC is out in building A. I can confidently say we moved everyone over to building B, and we worked hard to accommodate the larger groups. So right now, we're able to accommodate everyone. If we have groups over 40, it would be I don't think we're gonna be able to, we're gonna have to say pass while the temperatures are this high. But we also had to order more chairs. Now we have the classrooms all outfitted to accommodate all the groups. Planning is underway for our Eye on Health Youth Festival, and that's going good. We have, just to reiterate, some of the things that are happening there is vision screenings and refurbished glasses. That's for all ages. Although, we're hoping to get some kids out there with the beginning of the school year. There's going to be vaccinations for children. Again, if an adult came, a family member and needed vaccines, we're gonna ask that they have the adult versions of the vaccines as well. We have Vista Community Clinic will be providing a dental mobile unit. So they will be doing some, some dental screenings. The plan is to have a STEM zone featuring some of the different clubs at the Fallbrook High School, some entertainment of some local dance groups and other youth activities. There's an art zone being provided through Fallbrook Artists Association. And we have like a strong plan for marketing the event. We're in the process of creating banners and A-frame signage that would go up at Major Market has decided to be a partner with us. So we'll be able to put some signage at the entrance to Major Market, social media, email campaign, some partner marketing. So we got, all that scheduled, which is awesome to have Jasmine on board to really make all that happen. Even today, she was able to do much better at an email list I had been cultivating and got tons of responses through different partners. So that is really wonderful. In terms of our relationship with the school district, I was quite impressed that they reached out to us, Fallbrook Union Elementary School, in that to be part of the onboarding process for some new social workers they have. So they hired 5 new social workers, and they want them to all come and tour the Community Health and Wellness Center, and also to be aware of Katya's services with resource navigation. So I think that was really getting on their radar with that. We are also going to be presenting to San Diego County's Be There Summit. So that will be a lot of the medical community in San Diego, Mayor of San Diego, other groups on our diabetes prevention program. So we are being featured as that community-based organization having an impact. And so if you look on up there on the screen, you can see one of our members in the group who's had some phenomenal changes going on being part of the program. So I'll read her little quote. It says, as my cardiologist told me, by addressing my overall health, I have the opportunity to not let my heart get any worse and to even improve it. This lifestyle change program is definitely helping me achieve this goal. At my last visit, he let me know that all my blood panels have come into normal range and asked exactly what I was doing different. So that's huge in this amount of time to see that kind of change. And so obviously she was concerned about her heart, which is affected by diabetes, but even more than the pre-diabetic. So this is the kind of results that program's achieving. And I got to be the coach last night while Bianca's on vacation, and it's a phenomenal group of people. I mean, just seeing everyone, what the style and feel of our group, just helping each other and in there for each other. It was really, it was just amazing just to be there with everyone. So that
is that summit on the 21st? Is that the one?
Yeah, I believe it's on the 21st. Yeah,
Okay.
yeah. So, some of the other stats are on there. We're continuing to do the same things with flyers. We're going to be evaluating the distribution now that we have Jasmine. We had, we've been getting more press releases. So there was 2 press releases in the Village News about presentation we had for resilient teens and on our grant funding. So our email marketing continues to go strong. People are interested. Social media, is seeing growth. So on the last page, I can show you a couple of our well-performing posts. So you can see a lot of these partner events do well. This is a CPR training that we did with Mary Murphy and North County Fire. We combined it with pool safety. So this was like a new partnership with the fire district and went very well. We had a lot of people registered for that event. And we're also, if you scroll more, I know there was some questions about what kind of PSA and health tips awareness type posts. Here's an example of something that that ran the past month. So, because it was Social Health Month. And that's kind of what we were focusing on with our Wellness Wednesdays. So I don't know if you have any questions about anything.
Forgot to mention to in the committee that I was supposed to report on, but having Jasmine there, given the 30-day look was very important. And I thought it was helpful to hear her voice and how she's seeing things. I think we need to get a little more of that on a regular basis, because it's good to see how they're lit up and what they're getting excited about, and what's working, what needs more opportunities. So I wanted to pass that along again.
Yeah, thank you. And she's done a great great job of connecting with all like the Facebook groups that are out there. So various members of our community. So that's like constantly getting, the eyes of new people on what's happening. So. Okay.
Great job.
Good deal, thank you. I appreciate it. Yeah, there's definitely a lot of good things going on over there. It's really nice to see some of the positive impact with the diabetes lifestyle change program. I think that's definitely a game changer when you see stuff like that. I mean, seeing actual tangible results that are happening with people's health and their reactions. I mean, it's great to see. So really excited to continue to see that. And I think Bianca's obviously doing a really good job with that. So
We're working at the request of the group. They want to come in and just express their gratitude for the program. So we're working on a date for that. And that wasn't like us saying, hey, come share. That was them saying, we want to come and say thank you, and let you guys know, the impact it's having. So that will be coming soon.
awesome. Yeah, I think that'd be great. A good way for us to kind of evaluate like the impact and, see where we're gonna kind of take that. But I mean, it's great to, see the actual impact out there for sure. So thank you. It's also good to see some of the school district stuff. I mean, I think like Shay was mentioning, the getting into the school districts, how big of an impact you can make with just reaching all those families, because it is just so difficult, like with everybody's kind of going their own direction and Temecula or San Diego or wherever, but it's really good news. So thank you. I appreciate that. Rachel, CEO's report next.
All right, well, again, we already touched on a lot of my stuff. So there's a lot of facility. Yes, building A has no HVAC.
Has windows, right? You just open the windows?
Yeah, when it's 110 outside, it's only 100 inside. It's awesome. So the team over there has done a great job shuffling folks around. We are working with an HVAC provider to see what we can do. I was talking to Director Brown earlier about how we can identify a system to at least get the community hall back up and running. So we're working on a plan for that. It probably will get fixed to some extent or replaced after the worst of the heat, but we'll be ready for the cold. So we're gonna come up with a plan. We'll bring this back to strategic planning on some of the more specific details. There's a lot of new partners in conversation, so exactly what programs will be in what space is being juggled around a little bit right now. Some of our space needs may change with some of these new partners, so looking forward to bringing that as we get a little more information. So we haven't forgotten that the HVAC isn't working. We're just gonna look for ways that we can accommodate, and anything we do there, the priority has to be that will this be able to scale with us? If we do something and an investment in a building now, it has to be able to scale up for when it's that time to address that building.
Right.
So we are working on moving some of the pieces around. The lease agreement for the communications tower was provided over. I'm still negotiating a little bit with them on rent. I sent that over to Jeff to take a look at. So once we get that back, I'll bring that forward to facilities. So that'll probably be the following committee for that. We did a quick tour, Director Jeffries and Roz, Teresa, myself, we did a quick tour of the Gary and Mary West PACE to see how their PACE program is running. I'm still waiting for them to provide us a little more information about what kind of services they could bring and what that schedule could look like. We already kind of essentially through strategic planning agreed that it could be a good partner, but we need more information about what they're going to bring. They had requested to have quite a bit of space at the wellness center. Space is becoming a very important commodity. So before I think we finalize anything with them, we need some pretty solid information from them on what they're going to provide and the schedule for that. Because I think we have a little more leverage now, since that space is so highly utilized. Community partnerships, met with Fallbrook Food Pantry to discuss outlining a new MOU regarding the garden space outside of Building C, the house. I think it's an ideal space for it. It's a good collaboration. And again, we're serving similar populations and it fits within both missions. So you'll see that coming forward as well. As far as administrative projects, annual report, starting to draft that up with some ideas. Once we get the year-end financials, that really helps to get that ready to be sent out.
Any roadblocks with regard to that or bumps with regard to the financial audit?
No, actually, they were already here. This audit for this fiscal year, I don't anticipate a single challenge with any of the audit. It has been much easier than previous. Does that answer that question for you? All right, good. Working on the district's policy manual. This has been a behemoth of a project for a long time. There was a lot of policies we did not have. Our policies were at best a little dated. So I purchased the basic template from CSDA. We're modifying that right now. So once some of those big sections are done, I'll pass that over to Jeff to make sure we get his blessing on that. Again, following CSDA's template is nice because they've looked at that and vetted that and addressed items that we may not have thought of because it didn't typically fit with what we do. But as we're changing, we're making sure that we're updated and current with that. So that is a big project and the team is all tired of me talking about and yelling about policies from my office. You'll see coming back to strategic planning so that we're ready for the 24-25 year grant project, grant to revenue proportion. That will be part of the finance committee's discussion. Expectations of service provision will be strategic planning. And then again, continuing conversations about moving some programming from grants to MOUs. And that's one of the things that's already on there is Palomar Family Counseling. We've already obviously enacted that relationship. But that will be 3 different items that will continue to shape our grants program as we move forward with programming at the Wellness Center as well. Board and educations and conferences, as was mentioned, the CSDA conference is coming up. So Bill, Terry, Jennifer, Mike, and I will be in attendance at that event. So Barbara has to hold down the district while we're gone.
You're done.
You got this, Barbara.
The keys.
Yep, she'll be ready. She and the team have this one. And then in September for ACHD, the California Health Districts Association, that will be Bill, Teresa, Raquel, and I at that one. And again, that's a great one for ideas on how other districts are doing. And you're seeing a lot of these districts that have moved from hospital districts to community-based like we are. So it's a good opportunity for us to discuss and share what we're doing and see what they're doing for best practices. Second page, reminder, this is where I'm gonna brag to you.
I
Right, so I will be out of out of the country, really not accessible. The team is more than capable. Judith and Raquel will really be your primary contacts for anything that you need. I don't anticipate everything. We're doing a staff meeting tomorrow, so it should be easy. The team is more than able to handle it. In fact, they probably prefer it if I'm out of the office. Yeah, right.
That's what.
That's away. Feel free to do a impromptu board visit. Also note that in August, there will be no facilities or strategic planning meeting. September, there is no board meeting, facilities or strategic planning. This just really primarily has a lot to do with some vacation schedules, not just mine, but for the CSDA conference, the ACHD conference. So if things look like for the next couple months, just know that we know.
Okay.
We're good. But if things come up that need to be on an agenda item, make sure they're brought forward. We can make sure they get to the earliest committee or brought forward to the board, especially if there's an emergency. of any
Yeah,
sort.
due to the committee, I mean, the training up there too, I'm probably gonna not do the communication or that, government and
Public
awareness
engagement.
committee.
Okay.
2 weeks. I just felt like there's, if we don't have a strong agenda at that point, I'd rather roll it into what we were learning from this and
Perfect.
go forward.
Yeah, so we'll cancel the August
Yeah,
one. and
save everybody some time.
Okay, great. And then I promise my last vacation is in September, the 18th through the 21st. That'll be in Santa Barbara, so I'll still have my computer with me and we'll still be available.
That's not a vacation. Don't take your computer.
Yeah.
Can't help it.
Only 3 days, girl.
It's a short one.
Yeah.
It's a short one.
She's got all those games on the computer.
That would be against district policy on use of district things.
What page is that on?
I don't know yet. I just rewrote that one. We just pasted that in, so
Yeah, I
I
heard.
so other than that, we are still working primarily on a lot of facility stuff. As a real quick update, classroom number 5, the backside of the education building, the center room, that will start to go into construction for Palomar Family Counseling to be in there. That will probably be done right around the first part of September, which is when their MOU with us has started. So pending no challenges with the drywaller being able to get the windows in, which right now are the challenge, and getting the flooring done, we should be able to have them start probably the second week of September offering services there. So we'll start advertising that once we're sure that we can have those open hours. So that's just a small update that I didn't have on the report. And that's it for me.
Questions? No. Jeff?
So, one of my favorite, quotes is about 125 years old. It says that no individual's life, liberty, or property are safe while the legislature is in session. The good news is that the California legislature is in summer recess. And the bad news is they're coming back next week.
Yeah.
So there's not too much to report on the public agency legislative front for healthcare districts. There was an interesting bill that looked kind of helpful that was called AB 869 by Woods. And that bill had to do with compliance with the seismic requirements. And today that there's 62% of the hospitals in California are non-compliant with the 2030 seismic regulations. And this is a big problem. And it's about a 150 to 200 billion big problem. And so they're trying to figure out ways to maybe lessen some of the requirements. So they're still, not as over compliant as they were before. And also try to figure out ways perhaps maybe to extend it a little bit so that these hospitals have time to try to figure out financially how to comply. So this AB 869 bill was kind of interesting because it related only to healthcare districts. And there's a lot of healthcare districts, that are struggling and having difficulty being able to comply with the seismic requirements. And so what this bill would do is it was going to set up a pool of approximately $200 or $300 million, which was helpful. But it was also going to allow for hospitals working in good faith towards getting compliant to extend those deadlines from 2030 to 2035. Because there's no doubt that the legislature is going to have to do something to try to address this issue. You just cannot close down 62% of the hospitals in California. This is very difficult. So if you might recall, there was this down at Sharp, SEIU, which is a state union, was basically trying to unionize Grossmont. Okay, and Grossmont is still owned by the healthcare district. It's this district like this district was before with CHS. And they got into kind of a contest. And SEIU felt that that Sharp, when they were trying to unionize these Grossmont employees, was not playing fair or was playing, and whether or not, there's two sides to that. But nevertheless, they basically, this was a bill that Sharp was supporting because they wanted to see if they couldn't help extend some of these deadlines so it'd be easier impact. So in any event, SEIU popped up.
So we'll support it if you'll support us.
Well, what they did was they once you committed your sin, you're going to get punished. And so what they did was they popped up and opposed this bill that Woods was trying to get through, which would have helped all kinds of healthcare districts. Okay, or just specifically for healthcare districts.
Sure.
But it basically everybody got punished. So the bill was basically turned into a 2-year bill. And so they're working behind the scenes to try to get the governor to come around and try to get the unions to come around. So we'll see, but it's a 2-year bill now instead of 1 year bill. But that was something that was honestly for healthcare districts was a big deal, could help ease some of the pain. It's like we need to comply, but we don't want to shut down these hospitals. So the other thing is a real small bill, but it's the AB 557 called the Heart Bill. And basically right now we can, if we have another state of emergency and we, whether it's a plague, who knows what,
Heaven forbid.
then, but hopefully, but you never know. I mean, there's all kinds of black swans in life that come in and sort of upend things. So the bill was that currently would allow in a state of emergency, a declared state of emergency, allow us, because you don't want to be infected perhaps, or there's something going on, and whether it's a fire or whatever, that you could hold your meeting remotely. And so that bill expires in 2024, and this little bill said, well, we're going to extend that indefinitely, and if it comes up. So it looks like that one's sailing through, but just thought I'd bring it to your attention. But not too much going on the legislative front right now.
And you all probably been seeing this, but just from a big perspective of hospital care. Tri-City has suspended their OBGYN division. All patients are being sent to Palomar because of cash flow problems.
Well, what happened, okay, to be fair, Palomar came in and didn't comply with LAFCO and basically entered into contracts with the providers that were in Tri-City's district. And Tri-City objected to it, but once the horse is out of the barn, it's kind of hard to backtrack on it. So the census at Palomar or at Tri-City went down to basically a baby a day.
Yeah.
And they have an ICU unit, so it was not feasible.
Yeah.
Moreover, Palomar closed down Pomerato's.
Yeah.
Labor and delivery. So, this is something that's happening.
Point being, there are forces afoot. Kaiser opened in San Marcos today. There was a big hoopla. I happened to be in the area, all happy. But the other two Kaiser facilities, the employees made a big point today to say, you've siphoned off people and we're not adequately staffed. So that'll be a rock and roll. So it's just a larger perspective on hospitalness that is important for us to know. So I didn't know if everybody had caught those two.
And all those employees are represented by SEIU.
No, most of the nurses are represented by the California Nursing Association.
But
Okay,
the line
but the line people
are,
there's a lot of SEIU folks that are in there and, you know, these organizations are not necessarily anti-union. It's just that when you get into a negotiation with a union with these two particular unions, it gets really nasty and a lot of things are said and it's, you know, it's very tough. And I think one of the things that, you know, you can look at is it's hard, the days of the freestanding acute care facility,
Right.
like a Fallbrook or a Palomar or a Tri-City are really numbered. I mean, we're in a situation where it's with the constraints, financial constraints that are being put on hospitals, it's really tough right now. So there's gonna be some realignment. There's gonna be a lot of things that'll be occurring to try to, you know, we've seen it here. I mean, it's,
Right.
you know, it's really challenging.
Yeah, no, I appreciate those comments. I think that's definitely something to look towards the Kaiser that's in San Marcos. And then also they opened up a new surgery center in Murrieta. So I mean, I think that just even the Temecula Hospital opening affected our bottom line
Right.
quite a bit,
Right.
you know, just there. Just a question, just a clarification.
Yeah.
If they didn't do anything with the seismic bill and we had just continued to hold on to the hospital, we would be forced to like, you know, either raise a bunch of money or potentially close it in 2030.
I mean, it really would have been a struggle because it was operational, it was a struggle. And then you would have been faced with seismic issues. You would have had to gone out for a GO bond.
Yeah.
It would have been really hard. But what's nice about it is that right now, there's a lot of things that you're seeing and you've seen grown in the last, just since you've, you know, been on the board, you know, the years that all of you have been on the board, you've seen how the district has been able to help support services in the community and is doing more and more of that. And there's gonna be more and more of it. So you're positioned in it and frankly, a better place to serve the community in the sense that, yeah, the hospital's not here and that's important, but that was gonna go anyway. At some point, there was no way that thing could sustain in this kind of marketplace and this era. It's just very difficult.
And just for anybody that didn't get a chance to do like a tour over there too, I mean, it was pretty messed up. The whole top floor was totally unusable. They didn't have an elevator. I mean, there
Where is
was the hospital here.
Oh,
So
oh my God, yeah.
there's a number of issues. I mean, I think that a lot of times we get the people that come out that say that we'd like to have it, and I'd love to have an emergency room right there. But when you look at some of the challenges with the seismic regulations and
then
the potential trying to upgrade the elevators and use, I mean, the whole top floor of the thing was used for like old files from the 50s or something. So I mean, it's crazy to think that that's how it was utilized, but it's almost like I feel pretty good about how things are going at the wellness center versus what we would be struggling with right now with that building. So
We didn't have, we only leased the property to them. We did not have operational rights.
Yeah.
So they govern themselves. So we were just merely the landlords, and unfortunately, or fortunately, that's where a lot of the conflict came in.
Well, and don't forget that in 1997, the hospital was having trouble meeting payroll.
Yeah.
It was for all intents and purposes bankrupt. And the board at least, you know, went out and looked at a relationship with potentially with Palomar, with other organizations. And this outfit CHS came in and, you know, you got another 20 years of a facility here that was still available. And so, you know, it's you gotta view things in light of the times history, that in light of the times that they were made.
And Jeff, to that point, in 1993, that's when the Hillary new health plan came into play and the capitation payment arrangements started to come into play. Before that, you had indemnity 80/20. And And when you had capitation come into play, you were paid per member per thousand per month. So they'd look at the largest hospital, the largest medical group, and the largest network of ancillary providers, and that's where they would designate the patients and the providers. So when you had a small knit community like Fallbrook, trying to explain to them what was going on at that time, and if they didn't get an IPA, Independent Physicians Association, and get their network or get something going to be that, have a vehicle to have those types of contracts, they were not able to have those kinds of contracts and be successful. And then the doctors then couldn't practice solo, they had to become part of a group because that's how it was designated. And then you had management companies, and the business arena started to become more and more developed, so that the physicians were no longer able to have control of their own practices. The dynamics changed dramatically, and they're still changing now, you know, so
Yeah.
God knows what's going to happen. But that's why you've got great big management companies out there in Riverside overseeing the management groups that are overseeing the doctors groups, and you can't do anything unless this management group says, oh, you go over here or you go over there. And we're stuck because we're 11 miles away from Riverside,
Yeah.
you know, so
Tough spot.
we were in a really difficult spot. And we have done remarkably well under the circumstances. I think we should have a shield and a medal and a charging horse that says, we will continue to fight for our community. Because we really did do the best. And we have a birthing center here in Fallbrook now. We've got the family clinic that grew, and our grants programs have helped other services grow. So you got to deal with it one step at a time.
So we got this brand new ambulance that just
That's
came
right.
online.
North County Fire is from, yes, absolutely.
That's no joke. I mean, I think that is a great accomplishment.
Yes,
I'm all
yeah.
for doing another one.
Absolutely. So we're chugging along.
Yeah. Absolutely.
That's it. Yeah, I think it-
Didn't mean to steal your thunder over there, Jeff.
Jeff's thunder away.
We just have one more discussion, possible action item here to dispense with. It's the review and award for the youth fitness grant. Obviously, this has been a big thing for me. It was nice to kind of look and review some of the applications. I would have liked to see more applicants, you know. Again, I think we're kind of hit with the same, you know, trying to market and get people out and figure out like how to get people like connected with our services. But it was nice to see the four applications in there. I hope everybody had a chance to review the applications. I don't know, do you have any comments on these?
I don't have any specific feedback. I did communicate with most of these groups. They're all nonprofits, so they're all eligible based on our awards, because it is a brand new program. I think next year, I think it would be different. I think it might be more competitive next year.
Yeah.
But we budgeted up to a maximum of $25,000 for this year. The general conversation coming out of strategic planning was that looking at 5,000 per was the most comfortable range. So that's why you see all of them ask for that amount. But otherwise, they're all eligible and compliant. So it would be up to you all to decide whether or not you want to fund some, all, or any, or none, or whatever.
Understood. I would just make a motion to accept the grants as written, 5,000 each. If I have a second, we discuss.
Second.
Okay, discussion.
Absolutely. I
I'm
think it's
glad to
great.
see Bonzo was in the mix.
Yeah, I'm good with it.
I'm good with it.
I'm good with it. The only question I had was on the band. I thought there was the physical fitness side of it was a bit of a stretch. And it's no disrespect. I know they work very hard, but
Pretty much.
from a sports perspective was kind of the aspect of this, and, you know,
Well,
if we're gonna
it's
be
youth
broad.
fitness. It's not
Yeah.
just sports.
Okay, that's good.
So that is that small caveat right there.
And the second part of it is just, I think more clarity on, some of them had better clarity than others in terms of what exactly that money is gonna be used for. They just grab 5,000 and it's just a lot of information, but, and a lot of budget lines, but I didn't know exactly where they're putting it, or if we're gonna be constraining it next, I'm thinking about next year,
Yeah.
process improvement. Kind of a cover sheet that says, here's what we do, here's what we need, here's how the money's gonna be spent.
Yeah.
And that would be very helpful to help make the decision and make it a little more clear. Yeah.
Yeah.
But I'm good. I think it's a good
We
program.
had our information session, we tried,
Then that group didn't apply, right?
that
Oh,
group
yeah,
didn't
they
apply.
applied, Gave them all the information.
The only
they-
better- Oh, the process, I'm sorry?
Who are the five?
So it's 4 groups, so it is, the Bonsall Fallbrook Little League, the Boys and Girls Club, and their various, leagues that they operate. Boys Warriors Soccer Booster and the Fallbrook Band Boosters. So those are the 4 that applied. I did have a relatively in-depth conversation with the band group and explained, you know, this is about a fitness thing, so there's an expectation that you're gonna be able to provide information about the fitness, the activity. She's like, oh my gosh, these kids are marching hundreds of miles. And I said, well, that's great. That's the part we're gonna need more information from. So I think there will be some learning curve.
And it's how that money enable that, or improve it, or accelerate it. Those are the things. you know,
Right, well,
That's, you know, I know it's time.
and that's great. Folks who aren't used to filling out grant applications.
Understood.
So there's gonna
First
be some
time.
more education
No, I get it.
for
It's all
them,
good.
for sure.
Yeah.
Yeah.
I think it's a good first step.
Just an FYI, state of California allows marching band to fulfill PE.
Mhm.
Because of and having been a marching band person.
There you go. No, I know, I'm not trying to say anything negative against it. I know it's a ton of work, especially the 2 of us.
I thought it was at least good that they obviously they understood the physical aspect of it, and they
Yeah.
kind of wrote their application,
No, they told that.
highlighting
Yeah,
that or whatever, I mean, so,
Yeah.
but yeah, I think, you know, everything looks good. I mean, I think that in the future, we can, you know, take a look at some stuff and some improvements in the future.
Perfect. Yeah.
I just had one question pertaining to the youth fitness. One of the classes that we're actually going to add, I'm happy to say is I'm resurrecting Fit to Be Kids as a class. Which we'll talk to you guys about that because we'll want to use the wellness center. But what specifically was the criteria? I didn't even investigate it only because we currently aren't doing anything youth fitness at the moment.
Yeah.
But what were the,
Specifically, that you had to be a nonprofit entity, you had to be able to be providing fitness activities to kids and have some different reporting measures. But we can go over it offline. It's still on the website, so you can review the guidelines
okay,
and that as well. It is still pretty broad because there's an expectation of seeing how it would work.
recording, data collection?
Yeah, I think the big thing for us is to try to get more kids out there playing sports and getting active. And I think that this is just kind of our first attempt at trying to figure it out and get some data in and see what sort of impact it makes. But
Yeah.
I guess we'll see, right?
Yeah.
So, any other discussion? Okay.
I had a motion. Who was the second?
Jennifer.
Thank you.
Yeah.
Director Lynch.
Aye.
Director Jeffrey.
Aye.
Director Stanhouse.
Aye.
Director Morant.
Aye.
Director Brown.
Aye.
Thank you.
Awesome. That's it. Do we have any other board member comments or items for subsequent meetings?
We're not gonna have a meeting next
Okay.
month.
We do have a closed session deal that we'll do here. There is some future events that are listed, you know, as we said, a lot of them are canceled, but we'll definitely have a full agenda as we kind of come back. Director Brown?
I have a question with regard to attending CSDA. And any other events like that?
Sure.
Okay, what are there, 4 days, 3 or 4 days, 5 days? Okay. Does that count as one event or 5 events? When we do our monthly report?
Typically, historically, it's been considered as one event.
It's been challenged, I can tell you it's been challenged.
It should have been, but I'm just asking the question.
Yeah.
I have learned that as a board member,
It takes a lot to be able to support this district.
Yeah.
And I'm happy to do it, but it takes a lot. And then for a board member to be called away from their home for 5 days, I don't care what restaurant you eat at, doesn't make up for it. Whether I'm sitting on the board or you're sitting on the board, there needs to be some consideration for a board member's contribution.
Yeah.
To this district. So that's all I'm saying.
Absolutely, we don't have an active policy. Yeah, give it, I'll write that
I'll be
in.
happy to look at it, off the top of my head, but I do think that there's, like if you went there and took an ethics training course, you could get you could get a stipend for that. But in general, in most cases, you don't stay, most of the conferences, you come in for two days, okay? You might 2 nights or something like that, which would be a 3 days, so you're not normally there for 5 days. So the most common practice is a stipend, but I'll definitely look into that to see if there aren't, how we can do that, otherwise, because it's not like you're making a lot of money.
Yeah,
And I'm very good
my
with
point.
industry modifications like that. I mean, in a conference like that, I mean, each day you're doing like 8 hours of meeting. So I mean, I mean, you get the stipend for doing a 30-minute training. I mean.
Well, you have to look at it, it's the way the law is structured, it talks about meetings. Okay, so I can see where we can.
Well, the
Look at
point of the
that.
matter is, technically speaking, if we're having this discussion, each one of those days, there are at least 2 or 3 meetings going on that are at least an hour each.
Yeah.
That we would be attending, so.
The 2 issues are, number 1, it has to be an authorized meeting, okay? And, attendance at these meetings, so I could see the interpretation of that, looking at it from the standpoint of, well, this is a meeting today, and I got a meeting tomorrow, and then a meeting the next day, so, we'll definitely look into it.
So maybe council could get back to us on a position that would be appropriate.
Sure.
For that.
I appreciate that, thank you. So that's it, we'll break for closed session, I'll give the board, maybe 5 minutes if you guys need to use the restroom or take a walk. If you guys wanna hang out today, and it's fine, if not, I appreciate you coming out, thank you.
Thank you
Thank
very
you.
much.
Thanks for
Congratulations.
listening.
So you could go.
Hi, Shay.
Bye.